Okay, by my watch, it is time to get started. Welcome, everybody. Thank you for joining me tonight. My name is Laura Winnie, and I am the educator for DuPage County Animal Services. Tonight, we're going to go over basic pet first aid. So, what does that include? Well, we're going to talk about wellness and prevention. Just like with human health, a key to healthy living for our animals is to, one, prevent bad things from happening in the first place, and two, to catch them early. Then we're going to go over some safety issues and what to have on hand. We're going to have common illnesses and sicknesses, diseases that affect our pets. And then lastly, we're going to talk about wound care. Now, just a little bit of a disclaimer, nothing that I say here overrides anything from a veterinarian. Okay, I am not a veterinarian. I am not a medical professional. This information was vetted, pun intended, by a veterinarian. But still, if you have a question about anything in this presentation, your go-to is going to be your veterinarian. And I will actually say that a lot. Action step: go to the veterinarian, because there's only so much you can do even in a crisis without that giant knowledge of medical background going on and all of the equipment that they have at their disposal. Okay, now, before we jump right in, just a little bit of Zoom housekeeping. Everybody's doing a great job keeping themselves muted. If you have questions, you can throw them into the chat box, but I won't check the chat box until the end of the presentation. Typically, the presentation runs about 55 minutes, and then we have time for Q&A at the end. So if at any point you have a question, go ahead, throw it in there. I'll be checking it at the end. Also, please, if anybody has their video turned on, if you could go ahead and turn that off. Zoom gets a little angry at us if too many of us have our video going. And I have a few videos that I'm going to play during the presentation, so I don't want it to lag. So go ahead and turn your videos off. I know I miss seeing all of everybody's lovely faces, but just for the sake of Zoom, if you don't mind, that'd be great. Just to show you how that chat feature works, I'm going to throw the link to our survey in there. We are always looking for new information, new ideas, and, also just getting feedback on how we're doing. So I'm going to throw that in there just so you can see how the chat works for those who aren't familiar. Hopefully I'll remember at the end of the program to remind you guys to fill that out. But if I don't, it's there. And like I said, we're always looking for new ideas. So really appreciate the feedback, everybody. Okay, now with all that being said, let's get started in the good stuff. Now, as I mentioned, just like with human care, a lot of just general good rule of thumb is going to be making sure that we are preventing a lot of these illnesses before they get really started. So one of the best ways to do that is to make sure that you are paying attention to your health wellness, not just when you're seeing symptoms, but every day, because animals are amazingly good at hiding their illnesses and injuries. It's a survival strategy. The weakest ones get picked out of the herd. So their instincts tell them to hide any weaknesses. But you are going to know your pets best, better than the dog trainer, better than even your veterinarian. You're going to know what is their normal. So it's really up to us to note changes, because a lot of times we will see changes in their behavior before we notice changes in their physical condition. For example, lethargic. If your animal normally rushes up to the door to greet you and now they don't, that could be an indicator of something physical going on. Are they eating more? Are they eating less? Are there behavior issues? We get lots of people calling the shelter because their cats stopped using the litter box and they're peeing all over the house. Our first thing is always to say, take him to the veterinarian, because not using the litter box could be a host of medical complaints, from arthritis, maybe not being able to get to the litter box in time, to a urinary tract infection. They're just having to go so frequently, they can't always make it there, to all sorts of issues that we just see it as our cat being mean and peeing outside the litter box. Cats kind of got a bad reputation of being jerks, right? And when they pee outside the litter box, sometimes we take it personally. That's not always the case, guys. Sometimes peeing outside the box has absolutely nothing to do with us, and we're just the unfortunate people that have to clean it up. So definitely, if you have any behavior changes, that is something, that huge red flag that there may be a medical condition behind it. Also, knowing what their physical measurements are. Unfortunately, there's an old wives' tale that you can tell how a dog is feeling based on their nose. And that's just not the best indicator. Okay. A wet nose is no more indicative of a healthy dog than a dry nose is indicative of a sick dog. Really, you want to go for those key physical measurements that we use for people as well. Now, as far as temperature goes, dogs and cats naturally run a little bit higher than us. Okay, that's why they make such good heating cushions, because they tend to be a few degrees hotter than us. But remember, these are averages. So just like my normal is 97 degrees. My husband's is 98.7. We're a variable. That 98.6 degrees for humans is the average of all of humanity. All right. That's a lot of variables. Same thing for our pets. It's going to be a lot of variables there. So what's good to know for this stuff is to pay attention to these physical measurements over time, so you can get that baseline. All right. So you can know, oh yeah, my dog typically runs around 100 degrees. That way, if something is going on and you take a temperature and they're at 104, you know that something's going on there. All right. Same thing for breathing rate. So for dogs, it's going to be 10 to 40 breaths per minute. Cat is going to be 20 to 30. Easy way to do this is count how many breaths they do in 6 seconds times by 10. And that you don't have to actually watch them for a full minute. Okay. It's fun as it is to stare at our pets. That's a little intense even for me. So count how many breaths they do in 6 seconds, keep it on your clock, times it by 10. And again, do it multiple times, different times of day, to figure out what the baseline is, and do it when they're at rest. You want to know their resting breathing rate, because it's not going to tell you a whole lot if they've just run around all crazy around the backyard. Okay. Same for heart rate. You want to take that resting heart rate. So puppies, 120 to 160 beats per minute. Small dogs, 100 to 140 beats per minute. Larger dogs is going to be even slower, 60 to 100 beats per minute. And cats, going to be the highest of them all. They have like little hummingbird hearts, 160 to 220. Again, 6 seconds, times it by 10, and that'll give you a good resting heart rate. And knowing this, what that baseline is, what their average resting heart rate is, lets you, when you suspect that something is wrong, gives you the chance to look at that physical measurement to try to pinpoint what's going on. Okay. We also want to look at body condition. If your animals have gained a lot of weight in a short amount of time or lost a lot of weight in a short amount of time, that can be indicative of a very serious thing going on. It's amazing. I had a dog who suffered from cancer, and the amount of weight that she lost in just a month, if I didn't know that that's what was going on, I may have missed it, but when I looked at her pictures, before and after, I was shocked. Like, oh my gosh, she lost so much weight in that amount of time. But since you see it little by little, you don't notice it unless you're taking these measurements. So it's a good idea to take weight every once in a while as well, just to make sure that they're staying on that baseline. A really good way to remind us to take those baselines is to do a wellness check. And you could do this once a week, 10 minutes and just go over the major points of the body. So looking in their nose, looking for discharge, ears, eyes, mouth. Are there any weird smells? You know, what does it look like in there? You're going to use all your senses, except hopefully not taste. All right, please don't lick inside your dog's mouth. I don't need to know what's going on there. Also, just feeling down their body for any lumps, cuts, signs of pain. So if they wince or, you know, flinch away from you, if they're sensitive to an area, there might be something underlying going on there. Making sure that we're looking at their legs and feet, even in between the toes. This is tick season, and ticks love to hide out in the webbing between our dog's toes. It's a great place that they love to latch onto. Checking out their nails as well to make sure that they're not too long, that they're not cracked, that they haven't had any injury to them recently is going to be good. Checking out the abdomen. So this is a great time to check the breathing rate, pulse rates, and also checking for sensitivity. So again, just using like the palm of your hand, pushing down a little bit and checking to see, you know, do they wince? Do they react to that information? And listen to their breathing. Is there any wheezing going on? Does it sound like they're struggling to breathe? Has that breathing rate changed any? And there are lots of other indicators. So checking inside the mouth and the gum lines, if you look at these pictures, typically that healthy color is going to be that bubblegum or Pepto-Bismol pink. Some dogs do have black coloration inside their gums as well. That's perfectly normal. But you want to look at the colored part. If it gets really bright red, that could be a sign that they're overheated. If it gets really pale or gray in color, that could be a sign that they've gone into shock. So again, knowing what that normal looks like. And for these wellness checks, it's very easy to keep it fun. Okay, go into a room where it's just you and your pet, you know, away from distractions, have lots of treats. And, you know, a lot of times we do this not even thinking about it. We're rubbing all over their body, but they're just getting pet, right? It's just a fun thing to spend time with one of their favorite humans. It's just awesome. Okay, so definitely do it in a distraction-free area so both of you can pay attention to what's going on. And 10 minutes a week, not a big deal, and just taking stock, making sure nothing has changed. If you're the kind of person that is, you know, would lose their head if it wasn't attached to your body, make notes of anything different. Have a little notebook that's for each pet and make notes of anything that has changed over time so that you can see, like, okay, was sensitive here, otherwise fine. The following week, more sensitive here. Okay, that's time for a vet visit because it seems to be getting worse. And that can help you keep track of symptoms like that otherwise would probably be missed, and can really help you in early detection and early intervention, which is a key to helping with a lot of diseases in our pets and with ourselves. Now, first things first, we want to make sure that we are prepared before an emergency occurs. Okay, the last thing you want is to have blood dripping from something and you don't know where the gauze is. Okay, so it's recommended to have first aid kits made up for not just the family, but for pets as well. And it's pretty easy to put together a pet first aid kit. A lot of the stuff is going to be the same as a people kit. So the gauze rolls, the gauze pads, bandaging, like ACE bandaging, but there are a couple of things that you would want to add to a people kit to make it good for animals. Styptic powder or even a styptic pencil, that is a blood, I'm losing the word, coagulant, clots the blood. Okay, and you can get that in a powder in a cup. You might have seen that at the groomers or at the vets. If they accidentally got the quick on a nail while they were trimming, they just dip it in that powder and it stops the bleeding. You can also get it in pencil form and you just draw right on there. Hydrogen peroxide, not for wound care. Okay, don't put it anywhere near something that's scraped or bleeding. Instead, in pets, we use it to induce vomiting, We're going to talk about that later. And the reason we do not use hydrogen peroxide for wound care is because it actually kills healthy tissue. That bubbling is not a good sign because it's destroying a lot of healthy cells as well, and it can actually slow the healing process. So we do want to avoid putting hydrogen peroxide on wounds. An oral syringe to go with the hydrogen peroxide if you need to induce vomiting. A saline wash, so if your pet gets something in their eye, you can use that saline wash to flush it out. And a large towel. We're going to talk about the many, many ways you can use a large towel with your pets for first aid. Another couple things that you might consider having on hand. There are a lot of really great pet first aid apps. My favorite is the Red Cross one. Not only does it let you like test yourself to see how you know, because I'm a giant nerd, I like doing tests, but it also is just very easy to use. It's very well organized and it's free, so that's super fun. A 6-foot leash, we'll explain why that's a good thing to have here in a minute. A cat muzzle. So cats, when they get upset, they have their claws and they have their teeth. And sometimes we are doing things to them that is for their own good. But they don't know that. They just know that we're being super invasive and rude, right? So they might try to defend themselves from the loving care that we're providing for them. So a cat muzzle, you can buy them online. They're pretty easy. It's just a little piece of nylon that encircles the head. It blocks out their eyesight, so they're not going to be as stressed, keeps their mouths closed, and there's a little hole for their nose so that it's not obstructing breathing at all. And it just Velcros up around the back of the head. You can get them on Amazon for pretty cheap. An IKEA bag is also a great thing to have on hand because it can be used as a makeshift stretcher. Pet first aid kits, pretty easy to have. Recommend having one in your car, especially if you like to go out and about hiking, camping, and then also making sure that you have one in your house as well. Now, of course, a lot of the tools that we have in the pet first aid kit are to protect you because your safety is the #1 priority. If you get injured, you can't help the animals, okay? So if you come across an injured animal, whether it's your pet, somebody else's, what's going on, just like with a human emergency, you need to stop, give yourself a few seconds, you need to breathe, and then focus on the situation. You need to check the surroundings. For example, if you have a pet that was hit by a car, don't just run into traffic to go help the dog. Absolutely, we want to help, but we don't want you to get hit by the next car, okay? So survey your surroundings, make sure that it is safe. Approach the animal slowly, nice and calmly, and from behind. You don't want to sneak up on the animal, so you can make nice little sounds, talk to it in a sweet voice. But the reason we come from behind is because the teeth is one of the biggest things that's going to cause injury to us, okay? So when at all possible, we want to stay as far from the parts that bite us as possible. Stay calm and try to remain confident. I know that can be absolutely terrifying. I'm going to give you a funny story about my brother when we talk about some issues later on, but animals are great empaths. They can feel our emotions. And if we are panicking, it's not going to help them. So calm, slow breaths, focus. We don't want to stare at the animals. Most animals see that as very rude, and they're more likely to treat anything that you're doing as a sign of aggression if you are staring at them. So use the corner of your eye to keep an eye on them, but do not stare directly into their eyes. And that's just across the board. Even not in emergency situations, please do not stare at dogs or cats. Again, they're just going to think you're rude, and they're not going to like you very much. We want to use the least amount of force necessary because if you are scruffing a cat, you're increasing their anxiety, you're increasing their desire to get away from you, and potentially you are making any injuries worse. Always protect your fingers. It is much easier for an animal to grab on to an individual finger. So if you need to go near the pet's mouth, do the Ken doll, okay? Keep your fingers nice and close together so that there's less opportunity for them to bite around an individual finger, causing severe issues later on, okay? And then always, 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 as soon as possible, contact your nearest veterinary clinic, put them on speakerphone, and have someone talking to you while you're explaining what's happening. It may be that the situation is not as dire as you think, but if it is, now the veterinary clinic is up to speed on what's going on, and they can better prepare for when you bring the animal in. So it's always a good idea to have any vet clinics, emergency clinics on speed dial on your phone so you can reach them very quickly. And remember that any animal in pain, does not matter if you have had this kitten from when they were tiny, 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 and now they're 17 plus olds and they've never shown any signs of aggression. Any animal in pain may bite because they're thinking about the pain. They're not thinking about the loving person that they've lived with for the past 17 years, okay? So it's very important to protect yourself to make sure that you're not making a situation worse. So what are some good ways to make sure that we're handling these animals safely? With dogs, we want to control the head. Remember, keep the bitey parts away from us. So using muzzles, if you have them, and I'll show you how to make an emergency muzzle, and restrain if you need to. Now, again, least amount of force is possible. So the upper pictures here, we have an instructor showing 2 different ways depending on the type of dog. So a larger dog, you can use one arm completely, gently put them in around the neck so that it is facing away from you and the mouth is controlled, while the other arm is stabilizing the rest of the body. For a smaller dog, one hand around the mouth to keep it closed can typically do that. But again, those are last resorts. We're going to talk more about muzzling here in a minute because that's going to be the safest for everybody involved. Now, you definitely want to pay attention to their body language and how they're responding to you. Are they glaring at you from the sides of their eye? Are their ears down? Are they quivering? Are they showing teeth? Paying attention to how they are feeling will give you a clue on what you can do. You want to try to guide them where you need to go. Again, least amount of force possible. Use a happy voice, use treats if you can. And sometimes you can take, if you have them on a leash and they're injured, you need to get them out of the way. You can take a little bit of a running start and they will instinctively follow you. Now, only if it's safe for both of you guys to do that. But again, you're not dragging the dog, you're encouraging them to go where you want them to go. Now, cats have flexible spines, they have claws, and they have teeth. So they have a whole bunch of weapons they can use against you if need be. So when you're handling a cat, we recommend that you hold them facing away from you underneath the front as far at arm length, okay? Because again, that flexible spine, if you're holding them right close to your chest, they can easily whip around and get you with a claw, all right? Even better is have a barrier in between you and the hurdy things. Okay, scientific term there, hurdy things. The Pareto towel method, where you are wrapping the towel around the cat completely so that its claws are contained. This is especially good if you have to do any treatment to the eyes, ears, or mouth. Or if you are just needing to transport the animal somewhere, you can use a towel, drape it completely over the cat, scoop up the cat in the towel, and put cat and towel in the carrier. Top loading carriers work best for this because it gives the animal less opportunity to elbows out kind of thing, but you can also do it with a regular carrier. And then that way, they also have something to hide under while they're in the carrier, which is going to make them feel safer. Once you have a cat in a carrier, it's recommended to throw an additional towel over the top because that will make them feel more secure as well. They're more likely to be agitated if they can see what's going on or they can see people moving towards their carrier. And having that additional towel just gives you that extra barrier. Now, in terms of making an emergency muzzle, have a quick video here where you can just take a spare leash and use it. So let's watch this.
Okay, Finn and I are going to demonstrate how to do an emergency muzzle with a leash. So the first thing you do is tie a square knot like that and leave a great big loop. Secondly, you'll put the loop under the dog's chin, pull it tight, and then you'll tie in a bow around the back of it. It's got to go under the ears. Tie it in a bow. And you have an emergency muzzle. Good girly. Oh.
All right, and one thing that she doesn't mention there, the reason you tie it in a bow at the back is so that it's quick release. Don't tie it in a knot at the back, because if the dog starts to vomit or choke or have breathing issues, you want to be able to release that muzzle really quickly so that you're not blocking their airways and causing additional issues. Also, for when you get to the veterinarian, they want to be able to release it quickly to get to what the problem is or to put on their own equipment. Okay, so always make sure that you're using a bow at the back there so it's quick release. Moving on, we've got all of our stuff put together. We've got our kits. We've got one in the car. We've got one in the home. We are so set. Now let's talk about what can happen and what to do about it. This is a great one to start out with because it is hot. It is very, very hot out. And it's amazing how quickly heat can cause a problem. Any animal left inside a parked car, even when it's only 70 degrees out. So it feels cool to us, but the temperatures inside that car can reach dangerous levels pretty quickly, over 70 degrees. And they may experience heat stroke, also known as hyperthermia, and this can be fatal. It can cause permanent organ damage, and it can be fatal. So warning signs to be on the lookout for are excessive panting, rapid heart rate. So that's when it's good to know what the resting heart rate normally is. When you see that foaming at the mouth, if they're acting drunk or uncoordinated, kind of stumbling a little bit, vomiting if they've passed out, and those bright red gums are all signs. Now, for dehydration, an easy way to test for dehydration is to pick up some of the skin with a little pinch, and you pinch it into a tent and let it go. A properly hydrated animal, the skin's going to snap right back. If it keeps its shape a little bit and only slowly goes back, that's an indication of dehydration. Okay, so what do we do if we see an animal experiencing heat stroke? We want to remove them from direct heat as soon as possible. We want to place their paws in cool water, not cold, not ice. We don't want to apply any ice to any areas because that can shock the system the other way. Okay, so we want to gradually cool down using cool water on the paws. You can wrap their torso in a cool, wet towel, have a fan on, that's perfectly fine. You want to monitor those vital signs. And, is the heart rate going back to normal? Is the panting less? You can offer them, little bits of water. Again, not ice cold water. Use that nice cool water and then go from there. Contact your veterinarian though, because again, heat stroke can cause damage to the internal organs that we may not be able to see right away, that may not be present. So you definitely want them evaluated by a veterinarian just to be on the safe side to make sure that no lasting damage has been done. On the flip side of that, with our cold-related problems, frostbite can happen in as little as 30 minutes for some pets. And checking out what the warning signs are, blue gums, swollen skin that's red or painful to the touch. On the other hand, hard, pale skin that they don't even notice it, okay? Some affected areas in advanced stages can look black and appear dead. So that's where those nerve endings completely destroyed there. And it can be even more severe when they're not responding to pain, kind of like with a traditional burn. So we want to remove the pet from direct cold. We want to apply a warm compress to any affected areas. We do not want to use hot water. Again, we don't want to shock the system the other way. You can wrap them in a dry towel. If you find an animal outside, you can put them inside your coat and share your body heat. Again, only if it is safe to do so. You can hug them to you, but do not rub, because that can cause additional damage to the tissues and also be very painful as those nerve endings start to wake up. You know, think about it like when your foot falls asleep, how painful it is, that pins and needles feeling, that times like 100, okay? And you don't want to be the cause of that and be right there for them to take out their pain and upsetness on you, okay? Again, we want to monitor vital signs. So slowing heart rate, slowing breathing rates are also a sign that hypothermia is kicking in. Now that's more serious than frostbite. Frostbite is localized. Hypothermia affects the whole body. You might also see that their temperature, that their internal temperature has dropped. That's when it starts affecting the internal organs. Now, we definitely want to transport to the nearest vet if we're noticing any signs of hypothermia, because the vets have IV solutions that can help warm our pets from the inside and bring their body temperatures up at a safe speed faster than what we can do just ourselves, okay? So absolutely we want to talk to our veterinarian about any signs of frostbite or any fears of hypothermia. Seizures can be very, very disturbing if you see them and you don't know what's going on. Typically the animal falls over or they're twitching. They might urinate or defecate on themselves. You might see biting motions with their mouths, or their feet might be making running motions if they're laying on their side. In certain types or certain time frames of the seizure, they might be completely stiff and rigid. And it's really scary to see this. And I have seen this, and I will tell you, my brother has a dog that is prone to seizures, and I will tell you what not to do, because he did everything opposite of what I'm about to tell you. His dog went into a seizure. He didn't know what it was. He immediately scooped her up. He put his hand in her mouth to prevent her from swallowing her tongue. He put her in the car. He sat with her in the front seat, and he drove to the veterinary office. Okay. I know that the instinct is when we see our pet in distress, we want to get them help as fast as possible. But we need to stay calm. We need to time the seizure. We want to comfort them because sometimes they can still hear us even during a seizure. So, make sure that we are being comforting, but try to keep away from their mouth. They're not going to swallow their tongue, but they might bite you. Okay, so we want to keep away from their mouth. We don't want to restrain them unless they're in danger of falling off of something and hurting themselves. If they are on the floor, move away any furniture so that they're not going to accidentally strike something, okay? Now, we do have a video to show you what a seizure looks like, and then the veterinarian is going to go over some of the same information that I did as well.
A seizure is a startling sign of abnormal activity in the brain. And while there are many different types of seizures, in this video we're going to focus on generalized tonic-clonic or grand mal seizures. Now, during a seizure, your pet will lose consciousness, then become stiff, and this is the tonic phase and can last for about 15 to 30 seconds. He'll then develop jerking motions repetitively, and this can last for anywhere from 30 to 60 seconds. During this time, your pet may also urinate or defecate. And you may also notice a biting motion. That's actually very common in dogs and cats, that seizure. After the seizure, after this tonic-clonic phase, your pet will experience what's known as the postictal phase. Now, during this time, your pet won't be completely normal, although she will have regained consciousness. She may become glassy-eyed or unsteady or uncoordinated, and this can last anywhere from a few minutes to several hours. Caring for your pet during a seizure is about making sure neither you or your pet become injured. Never put your hand in or around your pet's mouth while they're having a seizure. And while you shouldn't try to restrain her, you do want to make sure that she doesn't injure herself by falling off of furniture or downstairs. Although it can be difficult to remain calm during a seizure, it's really important to take note of what happened. What happened before the event, how long did the seizure last, how long did that tonic-clonic activity last, and how long was that postictal phase. After the seizure, you also want to take your pet's vital signs and note that information before getting her to your veterinarian. Most seizures will stop on their own after about a minute or two, but if your pet has a seizure lasting longer than 5 minutes or has more than one seizure in a 24-hour period, this indicates an emergency and immediate veterinary care should be sought. Now, if your pet does have ongoing seizure activity, she could overheat. And so you may need to provide cooling, either by bathing her with cool water and providing fans or air conditioning during transport. You want to try to make sure you keep her temperature below about 104 degrees Fahrenheit until you get her to the veterinary facility, where they'll be able to help you take control of the seizures and keep her temperature under control.
Okay, so seizures can be a sign of many different conditions. It can come up from poisoning. It can be an indicator from kidney disease. It could be an underlying neurological condition that is causing the seizure, or even a head trauma. So really, if you are seeing more than one seizure, if this is the first seizure that you've seen in your animal, you want to do a follow-up with your veterinarian to find out what the underlying cause is. Seizures respond well a lot of the times to medication, so you might need to put your pet on a preventative medication to stop any further seizures from happening. So poisoning can happen even in the best of households. You know, we put something down, we don't think about it, and our pets, being the curious animals that they are, they get into it. Okay, so warning signs that your pet has gotten into something that they shouldn't have: vomiting, diarrhea, excessive salivation, and difficulty breathing, muscle tremors, excitability, and rapid heartbeat. So again, that's when it's nice to know what their typical resting heartbeat is. And then also those seizures and possible loss of consciousness. You want to verify, if you suspect a poisoning, that their breathing is normal and not labored, because if it is, that becomes the primary concern, making sure that they are still getting enough oxygen into them. You want to try to identify the poison. So check around the pet. Is there any indication of something? Make sure that you have a sample and you know what it is. Then contact your veterinarian or a poison helpline. So helplines are available 24/7, but they may incur a charge. But what's nice about them is that they can then turn over anything that happened during the discussion, and they can turn it over to your veterinarian for follow-up. So just be advised that some of them do have a charge. If you are advised to administer hydrogen peroxide, don't just do it automatically, because there are some things, once ingested, hydrogen peroxide isn't going to help, and it can actually make it worse by irritating the esophagus. So only administer hydrogen peroxide on a vet's orders. You want to use 1 teaspoon per 5 pounds of your pet's weight, okay? And so it's 3 teaspoons to 1 tablespoon. You don't want to exceed 3 tablespoons. So if you have a Mastiff, The most you're going to do is 3 tablespoons. And what happens is that hydrogen peroxide works pretty quickly. What I like to do is I actually measure it out in the spoon, and then I put it in an oral syringe. If you guys are fancy and know how to use oral syringe measurements better than I do, more power to you, but I do it that way to make sure that I'm getting the right amount. And then you can take the oral syringe, stick it, if it's a dog, stick it right behind their canines, hold on to the mouth, shoot it in past their tongue, and make sure that they swallow it. It can work really fast because it goes down, it bubbles, and it causes them to vomit. So when they vomit, you do want to make sure that you are examining the vomitus to see that something came up so that you can talk to the vet about what you are seeing. Okay? I know it's super fun being a pet owner sometimes. Now, allergic reactions can happen for all sorts of different reasons. Pets have allergies to things just like we do. They can have allergies to insects, plants, other animals, you name it, it can happen. So typically chronic allergies are not going to need first aid care. They're going to need more of a treatment plan. An allergic reaction to a sudden stimulant, though, that might require an action plan. So you might see hives. Boxers are more prone to getting hives over their body than most other dogs, but they do happen in other dogs. You might see redness, especially around the eyes, with swelling. Maybe the ears are getting really red and puffy. You might see them itching or licking at a particular site. Their eyes might actually swell shut. They might be vomiting. They could be having problems breathing, and they could collapse. So if they're going into anaphylactic shock, that is the most serious of allergic reactions. That is where the body is actually shutting down and where emergency care is needed right away. Now, if your animal has hives, a lot of times those will go away on their own as the allergen works through their body, but you do want to monitor any hives or swelling that you see, because even though most of the time, once they've been exposed to the allergen, you're going to see a reaction within the first 10 minutes. Not always. Sometimes it builds and builds and builds over time. So you do want to keep an eye on your pet if you see an allergic reaction and monitor that severity and the progress of any swelling or hives to make sure that it doesn't impact breathing. If there are any hot spots where they've licked and licked and licked and licked and the hair is gone and it's really shiny and red and puffy and gross, you might want to shave the area down a little bit, clean it with nice warm water, soothing, and get a pet safe topical. Okay, you might even want to go ahead and put them in a recovery cone, you know, the cone of shame, so that they can't access that site. If it persists, if the hotspot isn't going away, or if you see them multiple times, this is indicative of a chronic allergy, and you'll want to talk to your vet about a treatment plan. Choking is super, super scary. There are a couple different types of choking where your pet is conscious and becomes unconscious while you're watching, or you come upon them and they are unconscious, or they stay conscious the whole time. We're going to focus on the conscious choking, because once they become unconscious, then you want to switch over to CPR, which we're not talking about in this particular webinar. And for conscious choking, it is possible for them to dislodge something on their own, okay? So they might be coughing or gagging. Paying attention to what's going on is important, because if it starts to sound a little wheezy, then whatever the object is obstructing their airway and you need to intervene. But if they're coughing and gagging, it's possible they could dislodge the item on their own. You definitely want to make sure to secure the item if they do cough it up, so that they don't try to swallow it again, because pets are nothing if not persistent. You might see them acting frantically, you know, shaking their head, pawing at their mouth. Their gums might start to get discolored, especially if that airway is getting pretty blocked. And again, that's struggling for air. So what we do is we check to see if we can find what the obstruction is. So being as safe as possible around their mouth, we pry the mouth open and we pull their tongue forward. Now the tongue can be really slippery, so you might want to use some Kleenex or a towel or even your shirt sleeve to try to grab onto the tongue to pull it forward. Anybody that's watched a dog drinking water or a cat drinking water knows that there's a lot of tongue in there. Okay, so pulling it forward helps to clear the air passage a little bit more, and sometimes you can even see the object. So you might need somebody to help you restrain the animal while you're doing this, and you can do a 2-finger sweep into the mouth to try to dislodge the object. We don't want to try too hard with that because you don't want to accidentally push it down further, okay? So my recommendation is only if you can see the object to try to do the finger sweep, because if you can't see it, chances are your fingers aren't going to be long enough to get to it. From there, we can do abdominal thrusts. And it's going to be a modified Heimlich maneuver. We'll talk about that on the next slide. Or if that doesn't work, you can alternate between back blows and abdominal thrusts. For the back blows, you're going to put the pet in like a little wheelbarrow position or even completely upside down if they're on the smaller side. Find their shoulder blades, and with the flat palm of your hand, 5 blows right there between the shoulder blades. All right. Check the mouth again after each set of back blows to see if it has gotten pushed further out so that you can secure it. Now, when we talk about the modified Heimlich maneuver, there are 2 kinds that we can do. For medium to large pets, you can have them standing and you can stand behind them. You find the soft spot of their belly right below their rib cage. So bone, 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 soft spot, okay? You want to go right in the middle and put your hands into a fist. You want to put up and towards their head at the same time, kind of like a J motion, 3 to 5 times with your fist, okay? With smaller pets, small dogs and cats, hug them to your back, put their spine along your chest, wrap one arm up around the top legs, use a single fist, find that same spot, that soft belly part right below the rib cage, and again, that J motion. So in and up, 3 to 5 times, okay? I mean, think about it like you're trying to move the object from wherever it is in their airway out to the mouth. So you're going in and up each time. You can also do this if your pet is laying down. It's just a little bit more awkward to get a good grasp. So that just depends on the situation. The most important thing is finding that soft belly part, making sure that you're using your fist and going in and towards the mouth. So towards the spine, up towards the mouth each time, that nice J motion. All right, switching over to wound care when the worst happens. So starting off with something a little easier, insect bites and stings. You might see some mild swelling or tenderness at the site. And if you have never Googled pets who ate a bee, does give you a little bit of a chuckle, I'm not gonna lie, because their whole mouth can swell up, the muzzle, the ears, the eyes. The important thing is if they're breathing okay, all right? If they're breathing okay, it is possible that these reactions will go down on their own. You may not necessarily need to intervene. However, for like a bee or a wasp sting, if you can see the stinger, you definitely want to remove it, because stingers can release venom for up to 3 minutes after they've been separated from the bee. Never use tweezers because you might squeeze more venom into your animal. Instead, use a credit card and scrape it out. You want to try to limit your pet's movement, keep them calm. A faster beating heart is going to circulate the venom a little bit faster. So try to keep them calm. Use cool compresses to the sting site if you see any redness or swelling. Again, we're looking for signs of that allergic reaction, especially any issues with breathing. You can consult with your veterinarian about over-the-counter medications to help with the itchiness, to help with the swelling. There's liquid Benadryl that can be really good to administer, but again, talk to your veterinarian because some allergy meds that we use have toxic ingredients for our pets. So make sure that you are consulting with your vet before administering anything. If you see any signs of a severe allergic reaction or that anaphylactic shock, definitely get a hold of an emergency vet as soon as possible and take them there. For ticks, use blunt tweezers to remove, grab as close to the skin as you can. Take a picture of the tick. That way, if you notice any signs, there are many tick-borne diseases, then you'll know what kind of tick you had, and that can help the vet narrow down what diseases to be on the lookout for if your pet starts exhibiting any symptoms later on. Burns can happen in so many different ways, not just from hot pavement, but also, getting up on the counter while the stove is on. Or if you have a pink-nosed or thin-haired animal, they might be out in the sun too long and they can get a sunburn. Yep, dogs and cats can get sunburns. Or they might get chewing on an electrical cord or Christmas lights. That's a big one. Chewing on Christmas lights can cause electrical burns right to the mouth. It's really hard for a layperson to determine the severity of a burn, okay? Because some of the most severe burns don't have as much pain associated with them because those nerve endings have all been burned away. And it's just later until that overlying skin sloughs off that the pain really kicks in, okay? So you want to make sure that you are safely restraining the animal while you're inspecting the burn, because this is an area where they would probably bite because they don't understand what's going on and why you're causing more pain. Cool water compresses are good to use, but we never want to use ice, and we never want to use burn ointments for people because, again, those things have toxic chemicals that if our pets lick it off, or even if it just gets soaked up into the skin, can cause more serious issues. So anytime you have a burn, it warrants a call to your veterinarian because they're going to be more easily able to identify the severity of the burn and also to give you safe medication to treat it. Okay, for bandaging, it's important to know where your arteries are because you can use gravity against you. So the arteries are going to cause arterial bleeding, that's spurting, that's bright red, CSI stuff. Venous bleeding is darker red blood, it's a slower flow, and capillary is just like blood oozing, it's like a scrape. We want to make sure that we restrain and muzzle an animal because this can definitely be painful for them. Apply direct pressure. You can use anything from actual gauze layers to torn strips of t-shirt, whatever you happen to have on hand. If the blood soaks through a layer, don't remove it, add more on top, okay? Wrap gauze or even, again, strips of a t-shirt around the wound and secure. Tying it in a bow makes it easier for quick release. If it's on a leg or a foot and you're seeing that arterial spurting bleed, put the wound above heart level to help slow the bleeding. Let gravity help you here. And if you do have that arterial bleeding, applying pressure on or near the main artery for 45 seconds can help slow that bleeding, give it a better chance to clot. Okay, but only 45 seconds because we don't want to risk causing any internal damage to the limb. So make sure that you're only doing that 45 seconds to slow the bleeding for a little bit, again, while still applying direct pressure to the wound. And again, superficial blood oozing might clear up on its own. Anything deep, and especially anything spurting, that warrants a call right to your veterinarian and probably a trip to the emergency clinic. Broken bones, it's very hard for us to see this because, oh gosh, it's just so painful. You might have a closed break where the skin remains intact. You might have an open break where the skin has broken open and the bone is exposed. You may not notice that it's a break and the pet is just limping or potentially not moving. We want to muzzle the animal. Again, these are going to be very, very painful. You might notice some tender areas where you might suspect a fracture. If you see any serious arterial bleeds, for example, if they've broken their femur bone and they have cut open the femoral artery, you'll see that bright red splurting blood. We want to attend to that first. Okay, that's the priority there. Otherwise, we want to restrict their movement as much as possible. So you can use a supportive device like a towel or a leash underneath their legs to help get them where they need to go, or use a towel. Have a towel down and put them in the towel and, you know, carry them so that they're not moving. Lay the pet on their non-wounded side. It sounds obvious, but trust me, you're not always thinking that straight in an emergency. And then if possible, have someone else drive you to the vet so that you can remain in the back seat with your animal and try to keep them from moving around too much so that you can help keep them calm. And you do want to keep the muzzle on the animal the entire time, because if they move the wrong way and it causes a spike in their pain, that's dangerous for you as well. Okay, the last thing I want to say about broken bones is definitely do not try to splint or align the bones, because this can cause more damage. If they haven't had an arterial bleed and you're messing around with broken shards of bones, it could cut an artery and now you have a whole new emergency on your hands, okay? We don't want to apply any topical ointments. Leave any medication to the vet, all right? Because some ointments, one, are going to cause more pain, and at that point it's unnecessary. The important point is to get them to the vet so that the vet can do the x-ray, do the examination, set the bone if necessary, wrap and cast, and move on. Okay? Wonderful. Well, folks, that is all I have for you tonight. We're going to do questions here in just a minute. So if you have any questions, feel free to throw them into the chat. I'll get to them in just a second. But first, of course, I want to do a shout out for upcoming webinars. Starting in August, we're going to be talking about fostering. Fostering 1000% saves lives, and it's very rewarding. So if you're curious about fostering an animal, or if you already foster but you'd like some pointers, Fostering Success is for you guys. And for any animal lover, I highly recommend Wags to Whiskers Animal Communication. It's amazing how much our pets tell us that we miss because we didn't know what to look for. Since starting at the shelter, I have learned so much, and my relationship with my pets is so much better because of it. So highly recommend that one. And for anyone looking to up their game on their relationship with their pet and what they can do, we'll be doing Pet Training 101, our back to school theme, that first day in September. We'll go over basic manners and advanced tricks and tips on different methods for training with your animals. Now, at any point, if you folks have questions about domestic animals, wild animals, we are here to help. DuPage County Animal Services wants every animal in DuPage County to live harmoniously with people. So whether that's pets and people living happily ever after inside the homes, or if that's living humanely with the, band of raccoons down the street, that is our goal. So no question is too small. Please reach out to us. My direct email is humane.education@dupageco.org, or you can reach us at the shelter during our open hours, 630-407-2800. Again, we are here to help, so please feel free to reach out. All right, so I'm going to check to see if there are any questions. All right, wonderful. So a few questions. The link for the emergency muzzle video, it was on YouTube, and I will put that link, I will link to it when I post this video to YouTube. Okay, so this webinar is going to be posted to YouTube. I will also include a link to the muzzle video so that you guys can favorite it. And I'm going to send out the link to our YouTube video probably tomorrow. Okay. If you are interested in signing up for future webinars, you can follow us on Facebook. You can also follow our newsletter, and we do post the sign up information to our everywhere, to Facebook, to our homepage. So there are lots of different ways to see it. When I send out the link to the recording, I will also include a link to sign up for our newsletter and also a link to our Facebook page. So you guys will be so sick of trying to reach out to me because there's just so many different ways to do it. You won't know which one to do. And the answer is all of them are correct. Okay. Now for chronic allergies, there are a couple of different methods to deal with that. So one is to try to determine what the allergen is, trying to narrow that down. So you might need to do a food elimination test, just like we do with people, because dogs show food allergies and environmental allergies a little bit different than we would. Sometimes it's really itchy ears or those hot spots. So if you're noticing a pattern, it only happens in the fall. More likely to be an environmental allergy. If it's chronic itching all year round, food might be the culprit or something in your home. There are specific ones that you, specific diets that you can talk to about your veterinarian that are very, very limited. Okay. And you start with that. All right, so it's a unique protein food, and I'm blanking on the name of it right now, but you can get it through your veterinarian. It's a prescription diet, and then you can go through that, okay? I will tell you that I also did the blood test for the allergies, and it's hit or miss sometimes if they're going to identify the one that's actually affecting you. So talking to your vet is going to be a little bit easier. That elimination diet, as annoying as it is to start with one and build up from there, eliminating all of those wonderful treats and bringing them back one at a time, in the long haul, it's going to be the most effective way to find out, okay? There are medications that your dogs can go on. So for example, my dogs have seasonal allergies, and we have them on allergy medications during the summer when their allergens are present. During the winter, when everything dies off, we don't do the allergy meds anymore. So what I would recommend, because it is possible that it is multiple allergens that are affecting them, it also might be something in your home. So might be trying to manage where they are spending time in your home. Like Louis here, I have him in a separate building because one of my dogs is allergic to rabbits. So he stays over here in the office away from my animals. That might be something that you want to look into as well. Again, there are so many different things that animals can be allergic to, just like people. Okay, I joke that my dogs are the Niles Crane of the canine world because they're allergic to everything as well. There are varying levels that you can go to. Hi, Louie. That you can start with on the medication. Some as simple as injections. Those tend to be on the cheaper side, to daily pills that are going to be on the more expensive side. So again, that's going to be a talk with your veterinarian. And sometimes it is a slow road to find out what is causing or what things are causing the allergies, but stick with it. It took us about a year to finally figure it out, and we did. So stick with it. Again, veterinarian's your best friend, and keeping an eye on any patterns that you see. Even keeping a diary. If you see hot spots shoot up at certain times of day, that might be an indicator of what's going on there. So good luck. I hope that you can narrow it down and get your baby some relief soon, because I know how miserable it can be for everybody in the house. Trust me, I've been there. All right, folks, I don't see any other questions, but again, if they strike you, at 2 o'clock in the morning, feel free to shoot me an email and I will answer you as soon as I can. Be on the lookout for my email tomorrow for further information on upcoming webinars, other programs. We're getting to the point where we can start having in-person programs, which we're very excited about as well. So thank you so much, everyone, and have a great night.